Hello, dear colleagues. My name is Giorgi Sikharulidze. It's my honor to present to you today on the topic of day clinic psychiatry in Georgia, comprehensive care for mental wellness. This work is presented in collaboration with Professor Eric Vermeten. First, to understand the current state of mental health care in Georgia, we must briefly revisit our history. Georgia, with its 3.5 thousand statehood, has faced 2 years of Russian domination. The Russian Empire first occupied Georgia in 1801, and this continued under Soviet rule and occupation in 1921, until our declaration of independence, which took place in 1991. Even after independence, our nations experienced devastating conflicts. In the early 90s, we had the two wars in 1991 and 1993, and again the third war against Russia in 2008, which led to hundreds of thousands of internally displaced persons. Today, over 20% of our territory remains under Russian occupation. This long history of conflict has had a profound psychological impact on our population. The occupation of over 1/5 of Georgians' land continues to be a source of trauma and displacement. Now about the history of Georgian psychiatry services. During the Soviet era, mental health care in Georgia was predominantly institutional, with very limited outpatient and community-based services. From 1990s to 2007, we witnessed the beginning of transition. However, this period was marked by significant challenges: outdated infrastructure, shortage of services, and only initial step toward the institutionalization. A major turning point came in 2007 with the establishment of Mental Vita. It was the first private psychiatric clinic in Georgia. This clinic became instrumental in shifting care from institutions to community setting and played a crucial role in destigmatization of mental health issues. The next step was in 2013, with the support of Dutch and American professionals, the Georgian Ministry of Defense established its first military mental health unit. This initiative marked Georgia's first experience in developing modern, structured, and specialized mental health services for military personnel. These services were mostly based on outpatients and rehabilitation services, and the role of Professor Eric Vermeten developing this service invaluable. Thank you, Eric. This is the services this military mental health provided and provide right now as well. This is psychological recruitment, post-deployment assessment, suicide prevention program, military support program, and outpatient services include clinical assessment, psychotherapy, as well as CBT, EMDR, prolonged exposure therapy, dialectical therapy, psychosocial rehabilitation, psychoeducation, destigmatization program, and pharmacotherapy as well. Here is the first clinic which was built in Georgian MOD, and it was based on all types of rehabilitation, include psychological rehabilitation as a day clinic and outpatient services as well physical rehabilitation of wounded warriors. Now about our main topic. All the above mentioned experience lead us to seek about the next level of development. So in 2017, we established the first day clinic in Georgia, offering diverse services in an outpatient setting. This model reflects our mission to deliver individualized, evidence-based, and comfortable treatment options that significantly improve quality of life. The day clinic approach offers several important advantages. As we know, it's intensive care without requiring full hospitalization, cost-effective service delivery, increased patients' engagement, and greater flexibility in treatment plans. In this clinic, patients receive the support they need while continuing their daily routines, which is often essential for recovery. This is type of services the patients we provide for patients. There's the list: psychiatric care, psychotherapy, different types, art therapy, psychological assessment, personality assessment, child psychiatric care, child and adolescent assessments like Adolescent, Wechsler test, social skill training, family support program, body-oriented psychotherapy, and yoga therapy. The clinic provides comprehensive psychiatric care across a wide range of conditions. And what's the peculiarities of our clinic is that we have patients with a full range of diagnosis, of mental diagnosis. Include psychosis, of course, except of social danger, because day clinic is not suitable for this type of patients or with a severe risk of suicide attempt or radiation. Mood disorders include bipolar disorder, major depressive disorder, also treatment-resistant anxiety disorders, obsessive-compulsive disorders, personal disorders, post-traumatic stress disorders, and eating disorders as well. And statistics: on average, treatment lasts in our clinic from 12 up to 20 days. Our facility can accommodate up to 20 patients simultaneously, and our multidisciplinary team includes 4 psychiatrists, 4 clinical psychologists, 3 psychotherapists, art therapists, and so on. In addition to professional evaluation, we develop self-assessment tools that patients not only feel clinical improvement, but also it can assessed by self-assessment questionnaires, and in this you can see how the symptoms reduce, and it's visible and obvious for patients as well. And statistics: day clinic patients per year is about 350 up to 400. Outpatient consultations per month is from 700 up to 800, and psychotherapy sessions is about 400 or 500 per month. And which questionnaires and we use for assessment is we assess anxiety, depression, somatic complaints, OCD, CAPS for post-traumatic stress. Also, we have clinical assessment like Wechsler intelligence scale, IQ test, MMPI, 5-factor personality assessments like NEO, assessment for negative symptoms, and assessment for positive symptoms. An ongoing project and future development. We are currently running internship program for clinical psychologists and psychiatry residency program. I'm also pursuing a second PhD at Leiden University under the supervisor of Professor Eric Vermeter, focusing on evidence-based treatment methods. One of the majority obstacles we face in what the problem we have and how mental health, not only health system in Georgia, federal system, is suitable for the system day clinic. We have some problems because universal healthcare. It means federal budget does not cover does not cover the treatment in the clinic in Georgia, and private insurance provides only partial support. And we continue to work toward more comprehensive financial coverage for our patients. Challenges and barriers. We continue to face systematic challenges, including, I think it's the same in any countries, in country more or less, is a stigma around the mental health, limited funding and resources, a shortage of trained clinical psychologists, is, especially we have in Georgia, disparities between urban and rural areas in services access. So in future plan, we have aim to develop our services outside the capital city, Tbilisi of Georgia. Now I would like to show the video who explains how the daily routine work in our clinic. Voice. Can we share the voice? Yes.
Wellness restoration treatment.
Here. We need more connection. I have no connection. No. Sorry. Okay.
Restoration treatment. First Aid Clinic in Georgia, a mental health research center. Services of the highest international standards, professionalism and empathy, patient comfort and family-like environment, treatment with safe medications and daily monitoring, diverse services including individual psychotherapy, psychodiagnostics, in-depth study of mental functions, group therapy, art therapy, self-expression and self-development through creativity, team management of the treatment process, specialist conciliums, gathering and relaxation spaces for unwinding and socialization. Physical activity for mental health improvement. Green veranda for respite. Beautiful environment for tranquility and inspiration. Treatment results evaluation by specialists and through self-administered questionnaires. Regain mental wellness, emotional stability, strong willpower.
Thank you very much.